Welcome everyone. Today we have our another session on our healthcare conference, and I'm sure like our audience specifically they are getting a very interesting outcome from our honorable speakers. Especially we have our honorable speakers Professor Donalds, Professor David Smith, Madam Durga Das, Madam Ali Rice, and our very energetic friends Mr. James Eid. So hopefully this session will be very much informative and very much helpful for our Asia Pacific. And most important thing is that we are trying to solve different kind of uh, uh, problems around Asia Pacific, and we are figure out that healthcare is a major problem right now, and we need to solve this healthcare problem. And the speakers, they are very experienced, because those who join in World Talent Economy Forum with their academic background, with their corporate experience, with their research work, and they are actually contributing a lot for their community. So I request all of our audience, please share our content in between your community, specifically with your governments, with your corporation, and with your academia. Because World Talent Economy Forums, we are working with this government as well as corporations and academic relationship. So I directly want to go for today's sessions. First, Professor Donalds as a keynote speaker for today's session, he will discuss on digital health. Professor Donald.
Hi, good morning, everybody. Yep, I'm not muted. That's unusual. Well, I want to kind of just go over some of the high-level ideas about what digital health is. And I was thinking about it, and I broke it down into three major categories. One of them I call personal. And you will see that all these categories actually blend together and interact with each other, but it's a little easier if we sort it out in these piles right at the beginning. And personal, and then I talk about what I call institutional, then communication, and last, what I call, it's hard to find a perfect name for it, but it could be called research or modeling. And personal is the kinds of things like this guy right here, which is a Fitbit. And Fitbit is, these days, gotten so sophisticated that it, besides just counting the number of steps that I have, it also measures my heart rate. It measures my heart rate variability. It measures my O2 stats. It measures, let's see, what else? It measures my sleep patterns. It gives me a number for the stress that I have. And if I want to keep going, it will I can also record things like my blood sugar, and let's say blood sugar, calorie intake, weight, a lot of variables about myself. And that's why I call it personal. When you get to sleep patterns, it'll actually tell me during the night how much deep sleep I had, how much intermediate sleep I had, and how much dream sleep, REM sleep that I had. And so I can come see a pattern with my sleep. And that can teach me personally to be able to do things like be careful to not watch scary videos right before bed, because what that does is it gets my adrenaline up, and the adrenaline keeps me awake and messes up my sleep patterns. So if I kick back and read for an hour before I go to sleep, the kind of stuff I read definitely would put you to sleep. Most people anyway. And I'm going to get back to that. So what I call institutional is within organizations, it's absolutely critical for the providers, the healthcare providers, and this is kind of a general, as I said, delivery, for the healthcare providers to be able to have a history of what's going on with each of their patients. or clients, depending on what you call them. And that means that they need a record of often the same kinds of things that are on the Fitbit. They need to know their weight, their blood pressure, which the Fitbit doesn't take. They need to have the blood pressure either taken with another device. Blood sugar levels now have new devices that you can use. It used to be that the way that you test it is you'd stick a little pin in your finger and then use this little machine to be able to test what your blood sugar is. But now, recently, they're getting these devices which you actually have two little pins, and you stick it into your arm, and it'll monitor your blood sugar on a continuous basis during the day, and they're still not super accurate, but they're useful. And the institutional people have to interact with insurance companies. So in the United States is an incredible part of the medical profession. For people who don't know, my doctor can prescribe something to me, and the insurance company can decide that as a percentage, what the doctor prescribed to me won't improve my health enough on average that they want to pay for it. And then the doctor has to write a letter called a prior authorization saying, in this particular person's case, we've determined that this particular treatment will benefit this particular person. So the insurance company's default is to deny anything outside of a certain range. And I'll get to that too. And then the third thing I want to talk about is communications. And right now, if you switch from, I go to an organization called Palo Alto Medical Foundation, which it's superlative. I mean, I can go to specialists by just arranging for an appointment for myself, and they'll back do it. So if I go to the specialist first, my provider, my general practice provider will write a referral if it's needed, and which is something the insurance companies need. And however, they can take all this data and all this information, and if I switch to Kaiser, it's kind of a nightmare to get that information from Palo Alto Medical Foundation to Kaiser. There's no standards for this. And an interesting story about this is my thesis advisor at the University of Oulu in Finland made quite a bit of money. He's well off for a professor. And what he did was he made electronic data records that would transfer data from one hospital to another. Now, Finland is a top-down medical system. And yet, even in Finland, it was a nightmare to be able to get one hospital to be able to communicate with others. And historically, what happened is hospitals were one of the first organizations to computerize. And because of that, each hospital hired somebody and developed a computer system for that particular hospital. And those became systems that the people in the hospital knew how to use. And when you change a computer system inside of an organization, it's probably, most people think it's about as much fun as getting a root canal. People just hate it. They do not want to change the workflow, and with good reason. I mean, it's complicated. It's a complicated extra thing that you have to be dealing with right in the middle of extremely busy workflow. And so many of the hospitals just kept their legacy systems, and some of them still have their legacy systems. Palo Alto Medical Foundation has a new system. I mean, they built it themselves, and one of the things that's an advantage to me, and this goes back to personal, is that I can just look and I can see the results of every test that they've ever given me. I can see the doctor's after visit summary for every single visit that I've ever had. I can see a list of every vaccination that they've ever given me, and I can basically, every bill I've ever paid, and I can basically track myself. One advantage to the communication is that right now, we've got COVID vaccinations are being required under certain circumstances. It's not a government level thing, but at the government level, they're required for large rock concerts and things like that. But individual organizations are requiring it. For instance, the University of California is requiring all their students are vaccinated. Any organization can just say, we require everybody to be vaccinated. So some hospitals are doing that and others. And you need some way of proving that you've been vaccinated. And they give you these cards at the time that you're vaccinated, but like any other card that you keep in your wallet, it could wind up in the washing machine when you forgot to take your wallet out of your pocket when you put your clothes in the washing machine, or or be lost or destroyed in some other way. So what do you do then? Well, what happens is Palo Alto Medical Foundation, where I got my shot, and everyone else that gives a shot, if you allow them to do. CVS is a drugstore, Walgreens is a drugstore. There are places that you can go and get the shots. They all report to a central database for the state of California, and I can just log into that database and get my particular record and show that record. And because of where I got it and the fact that I have to have my fingerprint and other information to be able to get there, it's a completely valid way of doing it. So that's one advantage to medical records. But for your own personal health, it's incredibly important that you have the records available to people. You might get in an accident and wind up in the hospital and be unconscious, and they need to know that you're taking blood thinners or that you're diabetic or other kinds of things to be able to treat you effectively and not kill you. So I'm going to, as I said, I'm going to cycle around back through, which is, well, I'm going to go to the simulation aspect of it too. So now imagine that you have all this data about people. You can start analyzing the data, and it's beginning to get done. So I joined a couple of projects for COVID where I actually allowed the data from my Fitbit to be uploaded, and then I'd answer a questionnaire for a time. I did it every day. And it would ask me basically if I had the symptoms of COVID. And what it was looking for is changes in heart rate and other measures that my Fitbit had to be able to tell if by looking at people's Fitbits, they could identify where clusters of COVID were. And I actually participated in something like 3 studies like that. And so there's starting to be attempts to take your personal data and take that personal data and use it for larger public health. On a institutional basis, if somebody has atrial fibrillation, any number, congestive heart failure, any number of things, knowing your heartbeat and your heartbeat variation is extremely valuable information for your doctor. And what information we can get from the Fitbits is not really known yet. It's something that we're working on. It's a big data issue. You could tell how ambulatory somebody was by the same thing, the steps that you use for your own self. So that's one aspect of digital health that relates to you. And then the second thing that I'm going to mention in this thing of modeling is breakthroughs that have been made with things like what happened with COVID. They developed a model that showed that closing the schools and social distancing would vastly reduce the spread of COVID. Actually, it was developed by a 14-year-old girl as a science fair project. model was, and people didn't really believe it at the time. So putting those all together, what I'd like to say about somebody that's working in the developing world is that one of the things that you should look at first is trying to get your legacy systems to start working together with each other. So having a electronic data transfer protocol of some sort that works to be able to transfer the data from one place to another effectively is a critical level. And that is not an easy task. So what you really need to do is look at what's been being done successfully. Look at a small country like Finland. The information is open. Look at the United States and ask yourself the questions, or get somebody like us to answer the questions for you of which ones are the most effective. And it's not just a matter of transferring the data records. There's obviously, with everything digital where you're transferring information, there's privacy, and then your country's regulations and rules about privacy. I mean, they're different in the EU than they are in the United States. The ones in the EU are more strict. Privacy is considered more important there than it is here. I can imagine that in some countries where people are not as advanced digitally, there's probably cases where there's not that much privacy at all. You live right next to somebody, and in a small village, everybody knows what everybody else is doing. But that's something that you have to think through. And then the last thing about that is you can have the Fitbit until you can know your heart rate, you can know about your sleep patterns, but what good does that do you? I mean, those are just numbers. So you're going to be, just like anything else, dependent on your doctor to look at the data and tell you something. So the doctor looks at your data and says you should take this medication, or your doctor looks at your data and says that you should do this. But each person needs to know what that data means and how that data affects them, and how they can change the results that they get to show that to make their health be better. And so what's key is education, and getting people to change their behaviors is extremely difficult. I mean, have you ever tried to lose weight? Anybody here ever smoked and then quit smoking? I mean, it's very, very difficult. And for the medical professions, the people lie. I mean, maybe they don't lie, they just misremember what happened to them. So my wife is a medical professional, and she says, well, how much do you drink? And they say, oh, a couple drinks a week, and she knows they're not telling the truth by looking at their blood chemistry. And how you address those things is complicated. I look at our OASIS project at the University of Oulu in Finland, where we've been working on what we call persuasive technology for more than a decade. And there's a sister organization at Stanford. And what we're trying to do is to understand how we can use technology to change people's behavior. And I definitely make an attempt to walk 5 miles a day on my Fitbit. I know I'm actually walking 5 miles a day because of my Fitbit. I know how well I'm sleeping and other kinds of things that are information that's available to me. But it's important that we all know what that information means and why it's valuable. So that's my talk.
Thank you, Professor Donald. Anybody has any questions to Professor Donald regarding his speech, or any input you want to add with him?
I've been taking notes, so I'm going to refer back to them when I get my turn.
Okay, okay, yes,
But
okay. Professor David, you
I
want to
have
add
one
some
quick
point?
question for Dr. Donald. You talked about the interoperability of the healthcare records. You know, we have
we
Oops.
lost him.
Oh
I'm
no.
sorry. I'm sorry about that. I'm sorry about that. So,
That's all right.
Mr. James, yes, Thank you, Mr. Donald, for your continuous support for World Talent Economy Forums and very interesting, like insight you always want to add. I think Professor David tried to
So
join
many
with
notes
us.
from Donald. I'm going to rephrase everything I wanted to say based on what Donald said.
Okay, okay. Thank you. Yes, yes. Professor David
I
Smith.
think
Yeah,
I'm back.
yeah.
Staying on, I
Yay.
think, knocked me out. Uh, in the United States, we started with the standard fast healthcare interoperable records file, which is an attempt to begin to standardize and make interoperable healthcare records. And if the doctor does very good electronic records, it works well. But one of the challenges is
David, we
that some
can't hear you.
physicians,
I can't hear you, David. I'm sorry.
Something with your mic.
well, so many physicians are doing
Yes.
paper records
Much
still.
better.
And the paper records do not work with FHIR, the Fast Healthcare Interoperable Record Standard that Health Human Services has mandated. Uh, and so the challenge is not to get to the interoperability because we have the protocols to do that, but how to get the adoption within the healthcare community to actually use systems that meet the standards and to use electronic systems as opposed to paper systems. Um, You know, I'm amazed at the number of doctors who refuse to even do e-prescribe for prescriptions. And they prefer to give their patients paper prescriptions and make them have to travel and do the prescription fills. So even though I agree 1,000% that interoperability is a key problem here, it's also changing the culture.
I'm really sorry about that. Professor Donald, like you want to give any
Well,
summary?
he basically was saying that a lot of physicians are still using paper records. And I'm sure that that's true, but there's been a force in the United States that's forcing doctors not to be independent anymore. And that's basically the amount of money that it costs to deal with the insurance companies is so much that they simply can't have private practices anymore. The larger medical groups have a significant staff that works with the insurance companies. And because of that, they have to use electronic. I mean, inside of the larger organizations, they're forced to do it. I know my wife always, and in her organization, which is called Salud para la Gente, it's an organization for underserved people. And my organization, which is kind of high end, they both, they say they keep on file my pharmacy, and they just, send it to the pharmacy and I pick it up. So but it goes to what I'm saying is that it's very hard to change behavior.
Mhm. Thank you. Thank you. Yes, Mr. Jamesid.
Thank you, Sharif. Thank you for assembling another wonderful panel. I really appreciate being invited. And I do want to compliment Donald taking the lead off there. That was very helpful for, I think the fellow panelists will agree, giving us the context for this discussion. And one of the things that I want to say, I'm going to refer to what Donald said, because many of the points that he was making are points that I intended to make. But I want to talk, I'm going to divide it into categories of the past, present, and future. And I might leave the future discussion in case of time. But in the past, my mother is 94 now, had a family doctor. And the family doctor would come if one of her children were sick. The family doctor would come and treat the child in their home, and then have coffee with my parents afterwards and talk. And so he knew the family, he knew my parents, he knew everybody, and it was a very different way of treating the health care system. This is not at all what it's like today. And in the future, we might have a more personal relationship. I don't know. But there's an old saying, an ounce of prevention is worth a pound of cure. And our healthcare system is focused on cure, not on prevention. So this is for down through the ages, we have known it's better not to get sick than to treat someone who is sick. But that's not how our focus is oriented today. There's a tremendous amount of information if you search the web for how to get better. And there is also a lot of information about how to stay well. And so I always say, start with yourself first. And some of these devices that Donald was talking about, I've used, I recommend them if you can afford them. I've worn the Fitbit. I have never worn an Apple Watch, but I have my step count monitored on my phone. And, I track it as a sign, he has, good job for your 5,000 steps, and I'm not going to tell you what my total is, but I track it. And I know that if I hit it, and I know if I don't, maybe tomorrow I have to do a little better. So it's a way of disciplining myself to make sure that I get enough exercise. And there's another thing about start with yourself first. If you take a moment of meditation in the morning, you may know how well you slept. You may not need these numbers to tell you this information. You may understand by just checking in with yourself, by meditating, and how do I feel? Do I feel restless, irritable, discontented? Well, there's something that I need to work on. Do I feel hopeful, joyful? Do I feel content, serene, peaceful? And perhaps my sleep had something to do with that. Do I feel energized, or do I feel as fatigued as when I went to bed? These are things you pay attention to. And the numbers can help you, yes, but you can do this without them. Just by a little bit of morning meditation, checking in with yourself. How do you feel? How does your mind, body, and spirit feel? Check in with yourself. Take personal responsibility. And this is also part of what you have to do with any healthcare system. You have to be your own advocate, or you have to have someone advocating for you when you're sick and cannot communicate, cannot think straight. Then you have to have someone doing that for you, because these systems must be pushed. And you have to know these systems to be the most effective. Now, don't just throw your hands up and say, well, I went to the doctor, that's all I could do. No, figure out, pay attention to your body, pay attention to yourself, figure out, give them all the input that they might need to make a rational decision on your behalf. So these are the things you take charge of as an individual. And when you're trying to work with a healthcare system, how they're organized today is not ideal by any stretch of the imagination, but you can use them as effectively as they can be used. If you are your own advocate, take personal responsibility for this, and be there for someone else who's sick, may not be able to think clearly, may not be able to advocate for themselves in their health community, in their health challenges. So it's, be there for someone else too. So, be part of your community. If it's your immediate family, loved ones, friends, family, help, because nobody can do this alone. Nobody, because I know that my health challenges, sometimes there was no way I could communicate to the doctor what was going on. I had no idea. And my wife was able to. And that was very valuable. So, look out for others as well as yourself. But start with yourself, then your community, and who knows where it'll go from there. The couple of things that I wanted to talk about, Donald used quite correctly the terms legacy systems and transfer protocols. Legacy systems, I just want to give you an example of this. In the chess world, we used to keep our ratings, our performance ratings, on little index cards. And, so this was very time consuming, error prone. And so we would get an update every 3 months. We migrated to the computer age when we could, with some hemming and hawing and gnashing of teeth, but we did. but that required a lot of data entry from the index cards into a computer system, which is also manually intensive and error prone. And then you had to keep the databases current. But now the rating systems are kept up to date instantly. If you play a chess tournament, it ends on Sunday, Monday, you have your rating. So these are the things. But how do you get that transfer from the index cards into a computerized system? This is the transfer protocol and if you're looking for a skill set to have, people used to ask me, what do you do? I said, I'm a protocol converter. Because I would take a legacy system, and a legacy system is a system that's still vital, but no longer fits. And you have your live system that is the primary source that can be upgraded, that can continue to be scaled, continue to grow. That's the system you want to, but the legacy system you can't quite get rid of yet, but you have to get them working and talking and somehow. But the legacy system is operating on old software that doesn't communicate. So what do? You get in the middle and you figure out, well, this legacy system is using this language, and this computer system, this modern system, is using this language. How do I translate this old language to this new language? So you translate. You're a protocol converter. And that's what I did, and it was quite a nice little niche to carve out in terms of career paths. So these things. This transfer protocol is essential to the medical community because they are stuck in the legacy systems. And how do you get them all connected? Now, if you can get them all connected, so it doesn't matter if you're in California, it doesn't matter if you're in New York, you can access the same records. And you can proliferate them. Blockchain is an ideal way to proliferate all of this information so it's accessible and it cannot be corrupted, because it's updated in multiple sources, multiple places. Its storage is distributed. So these are future potential solutions to these old, outdated legacy systems that we want to let go of, but we have trouble to because they're still vital. So this is the way that we're going to approach the future, I think, in terms of digital health. But then it raises questions of privacy. Well, if my records are distributed everywhere, then who can see them? Turns out anyone who can access them can see them and know everything about your personal health. So is that something we want? Well, how do we secure this data? So this is another thing that has yet to be worked out, but the potential to work these things out. As I always say, after every problem, a solution is trailing just behind it. So these things will be worked out, but there will be growing pains and transference pains. There's no doubt about that. And in terms of developing countries, the people that I work with in Uganda, particularly the person I work with most closely, he, his wife, his son, and his brother have all just recently had bouts of malaria. And so, this is not, they're not connected to these distributed systems. They don't have that connection. The only way I can help them is to transfer money from one location to another location that he can receive it. And so that could pay for a hospital stay or something like that. But, he's not connected. So his medical history is completely, he doesn't have a Fitbit. He doesn't have a smartphone. He doesn't have these things. So we want to address these solutions for people that have accessibility to this data and for those who do not. We cannot leave them behind, not if we are a just society. So those are all wonderful things that I wanted to talk about. Be a self-advocate, the technology will give us a feedback loop. And so that we will know more about ourselves, about our own personal health. But no matter what system we put in place, you're going to have to be your own advocate. You're going to have to know what you want for yourself, how you can thrive in this lifetime, and find out how you can get what you need to thrive. These are things that you're going to just have to sign up, show up, and do it. And I think changing from sick care to health care, prevention, changing our focus on prevention, staying healthy. How can we stay healthy? How can we do better about that? Let's make that digital information accessible to all. And I think we'll be a healthier a fair society. And thanks again, Sharif.
Thank you, thank you, thank you. If any speakers want to ask any questions to Mr. James Eid, you can ask. Beside that, anyone at some point with Mr. James Eid, you can. Who want to come first? Professor David?
I was going to say, sorry.
I
Okay.
agree with so much of what he said. Healthcare is really a personal decision that you have to make and actively be involved in. There are many studies going back to where the more you're involved, the greater your results are back from your healthcare journey, be it physical health, mental health, even educational health, because the educational health actually relates directly back to your mental health and your physical health as well. And that's why many places are beginning to move their healthcare systems from being reactive healthcare systems to proactive healthcare systems, which I agreed with almost everything which he said on that side. So thank you for framing it so well.
Thank you, thank you, thank you. Anyone want to add some point?
The only point I'd like to add is, I think James and I always kind of tend to veer towards the physical and the metaphysical and the spiritual angle to health and to wellness. And so thank you very much for that, because that gave me a segue and a confirmation that I could speak a little bit about it. So thanks for that, James.
Thank you, thank you. Now I request Madam Ali Rice, like for your speech. It's a 10-minute
It's really
speech.
interesting
Yes.
because I'd written. Can you hear me? Yeah, can you hear me? So I'd actually written that we needed to make sure that we were covering mental and physical health as well, and spiritual health is
Just
also.
increase the volume a little bit, just a little
Sorry,
bit.
Yeah. Hold on a second. I don't know whether it's. Oh, I think it's. Can you hear me? Okay. Can
Yes.
you hear me? Okay. So I practice yoga and meditation, and I've practiced yoga since I was 14. So almost 40 years, and meditation I've been doing for about 6 years. But I think personal responsibility is really important, and that also includes.
Sorry, Ali, could you speak closer to the mic, please?
Sorry, yeah, no.
Yeah, this is much better when you're closer. Yes, thank you.
So that's what I was going to say. I've got a family too, so I've got 2 children and a husband. And I think the thing is that we also need to think about simple things like the food we eat and the way we, our lifestyle. I walk every day as soon as I've done the school run, unless I'm actually on site, which hasn't happened since lockdown until recently. The first thing that I do is walk my dog. So, and I do use a phone to keep track of my steps, but I'm not reliant on technology to do any of my fitness. I do self-practice. So I think discipline's really important. So, and I think the fallout of, the mental health, particularly on our young people, is going to be the after effects of what's happened in COVID times is going to have a massive impact on mental health, much more so than physical health. So I'd looked on the website for the kind of the National Health Service in England as well, and their 3 criteria was healthcare, but health improvement and prevention as well. So I think preventing problems in the first place, because we make good choices, and that's simply by having, instead of buying convenience food, cooking from fresh produce, and so it's real basics that most of, surprising. I don't know what the statistics are, but there's a lot of people that buy convenience food because it's easy as opposed to cooking from scratch. And primarily we cook from scratch still, and we do make good choices. So our children don't eat tons of sweets, and they make relatively, so it's kind of, and I use meditation apps. I use the so I think there's definitely a place. And since lockdown, we've had doctor's appointments online because that was the only way to do things. So I think what's really interesting is digital health, and that COVID's enabled people to realize that there's a possibility to have a quick chat with a doctor if it's something that's not that so serious. So no one has to go anywhere, and it kind of limits the time that anyone has to spend doing anything. So I think the thing is the digital provision to make, have consultations for minor things is great, because you can get your prescription and, be done with things, and it's a much quicker. Whereas if you actually go in person anywhere now, I went to the dentist probably 2 months ago, and seeing the dentist now is a much more elongated. You have to have a COVID, you have to have your temperature taken, and there's less people that you can see in a day because everyone's got to distance, and you can't have people in the waiting room, and it's so it's kind of. So I think the thing is the digitalization of things that are quite easy to fix is fantastic, but I think for consultations when people really need to be checked and physically evaluated, that still needs to happen too. So I think that I think to ease the pressure on the system, the digital health's fantastic, but there still has to be a time when people need to be assessed. So when there's serious conditions, or that you can't get away from actually physically evaluating someone as well. But I think the digital health is fantastic for dealing with minor things, or or just evaluation and assessments or prescriptions. And we've got obviously still got a national health service in the UK as well. So essentially most of the small things are covered by the NHS. But I think the system's actually not very sustainable. So we're being pushed further and further towards a private healthcare system too. So yeah, it's interesting. But definitely I use digital, but essentially our well-being starts with us and our families as well, and then the community, and kind of keeping active, making good lifestyle choices is first and foremost, and that and then kind of long term we need to look at how digital. I think it's great that you can monitor your heart rate and do all that stuff, but for me, I think I'm not that bothered about my heart rate, so I'm just bothered that I keep fit and active, and that when I can tell when my body's got problems. So I think kind of having that intuition and taking self-responsibility first and foremost is a great way forward, so that we avoid the problems in the first place. So yeah, interesting about the metaphysical and spiritual thing as well, because I've been quantum downloading, which apparently I didn't realize I could do. So I can now quantum download poetry. So yeah, but that's so I just think the spiritual and physical health first and foremost starts with the individual, and then kind of moves forwards. And the digital, it's exciting, but we still need to, definitely in the UK, confidentiality of records, particularly health records, is really important. So I think it'll be a hard thing to persuade people to let that information and data go to just anybody, because it's something that everybody's always kept as a private thing. So yeah, we'll see.
Thank you.
Okay,
Thank you. Thank you. Thank you. Anyone want to add some points or any questions or something from our speakers?
Yeah, I do, if I may. The quantum download, I've used the word download, and I think we're talking about the same thing, but I'm going to adopt that without attribution, by the way. And I wanted to talk a little bit about something that Donald touched on and Ali touched on as well. The idea that people don't report accurately to their doctors often. They may not be consciously lying, but they may be lying to themselves first. And this delusional thinking is so common that we don't want to be in a blame mode. We don't want to say, just be honest. Being honest is not always something that it's so easy to do, because we can use things like, I don't want to admit how much I'm drinking because there's a shame element, or I don't want to say that I've been eating too many sweets because there's this element of shame, or people will look at me differently, or they will judge me. I don't want to be judged. So there are a lot of social pressures on individuals to self-delude, to say they're better than they are. And we have to find a more, lay out a more welcoming atmosphere then to enter into and tell the truth, knowing that they will be safe, knowing that they will not be judged. And, you know, unfortunately, the digital aspect of it is just numbers. There's no judgment. There's no good or bad. It's just a number. So, Ali, what do you think about that? Do you think that just making it more numerical will overcome that? I'm not so sure. I'd like
And
your...
I think one of the things that's interesting to me is that with the app, because I'm not that bothered about how many steps I walk, and my dog's been injured, so if I was worried, I haven't been able to walk as much because she hasn't been able to walk as far. So I think the thing is, but I know that the apps and the Fitbits have incentivized people that I know to be more active. So, you know, it's a great way to do, you know, and because it's somebody that I know actively walks 10,000 steps a day because she's got her monitor and she's got dogs too, you know, so it's kind of, if that enables you to do what you otherwise wouldn't do. But for me, because I've got a dog, I always walk because that's my obligation and I love it. So I connect with nature before I've done anything else, you know, and she's, you know, so kind of, so having a dog's kind of another option. But, you know, it's kind of, we live in the countryside, so, you know, it's kind of a great way to start the day, so regardless of the weather. So yeah, so I think, but no, I just think, and the thing is, because it's on an app, it's a personal incentive, so you don't necessarily have to share it unless you want to. But I know somebody competitively that's running something like 50k, and he actively competes with his friends to see how quickly his run, whatever distance he's running, and he's doing a 50k big race that he's fundraising on. So, you know, it's kind of, there's an opportunity to be competitive with people, as well as personally just set goals that suit you. So, you know, there's an option to be a part of a group or individual. And I know, you know, throughout the lockdowns, I've been mentored by an incredible entrepreneur in Australia. And you know, those connections and the groups that I've been part of throughout 2020 and onward have completely changed my perspective on everything, sorry. So that I haven't been filled with fear about anything, and I will never be, because unless there's an active, you know, so I just think that the way the mass media has continued to, they're still fear mongering here, and 61% of the population here has been vaccinated. That's crazy to me, because if I went to India and I was given the yellow fever vaccine, I wouldn't even think twice about thinking that I was protected. So I wonder whether people even trust the vaccines that they've rolled out, to be honest, because, you know, it doesn't make any sense to me, you know, and, you know, so for me, I worry that, you know, that people still need to, unless you've got underlying conditions, and you can be fit and healthy and keep, you know, so it's fundamentally the way that I conduct my life and walk in the dark, as you know, that's the one thing that hasn't changed all the way through 2020, and it's kept me grounded, and the meditation, you know, so it's kind of, so it's, you know, so I think that's, you have to be centered first before you look at the outside world, you know, it's kind of, and keep your children centered too, so they feel safe, you know, so that they're, and then, you know, and then hopefully it'll have a knock-on effect. So yeah, for me, we're hoping that our restrictions are lifted. I think it's the 18th of July over here in the UK, but everybody's had enough, you know, it's kind of, yeah. So the children,
Thank you.
Yeah, sorry. Carry on.
Yeah. Thank you for your excellent analysis. But now I request Professor David Smith. Yes.
The whole area around this topic is one that has so many variations and permutations to it that as I look at implementing the public health, the healthcare systems throughout, particularly the many regions that your listeners are in, it's important for us to, again, take into account that healthcare will have variations within the regions. I'll give you a great example. In the United States, because people who are in Maine eat differently than in people in Louisiana, which eat differently than people in California. Oftentimes, the medicine reacts differently. The results from tests are differently just because of the local culture, the local customs, the local food you begin to eat. And as you begin to look at the policy to implement public health, those type of variances must be taken into account as you do that. A very other interesting part as I look at public health and the healthcare systems within a region is it is made up of more than just going to a clinic, just going to a hospital, just going to other specialists like nutritionists or uh, psychologists and others. It is also made up of, for the children, what they do in school with the school nurses and the other professionals in the school systems. It's made up of the occupational health that you might see inside companies as well. And one of the goals, I think, if I were to able to do a clean slate design of health systems and public health, is I would start with a way of saying it is that entire ecosystem. And how do you get that ecosystem to share information? As Donald said earlier, sharing that information is critically important. Now that we're moving into much more digital solutions, where the watches, where the smartphones, where the Internet of Things devices are proliferating, how can we begin to take those and share the data from them across these different areas of the stakeholders and be able to do things with them across it? You know, there's articles that says data is the new oil, and particularly in healthcare, data is extremely important. But what the analogy of data with the oil is that I think is directly applicable to healthcare and health systems is that when oil goes to the refinery, it's refined into many different products. You know, it might be cooking oil, or it might be gasoline for my car, it might be jet fuel, it might actually be some of the derivatives fertilizer to help grow plants as well too. Well, the data in healthcare has the same type of breadth and reach as is oil would in that analogy. And public health in particular needs to understand that there's tons of data that can be used in very different ways. There's personally identifiable information, which should have some of the highest privacy restrictions, some of the highest security restrictions. But when I de-identify that data, it should be used much more broadly to set public policy. It should be used to help change what the best practices are within the healthcare system. You know, we've talked about modeling in manufacturing. We've talked about modeling in so many different areas. But as you begin to get this greater trove of that de-identified data, it can have major impacts to advance the care in a region, in a disease state, and other things like that. Just looking at the advances we've made in treating some of the common diseases because we have a broader set of data. And we can now begin to look at data across multiple demographics because demographics plays a very important part in public health as well. We know certain races are more acceptable to asthma, to diabetes, to sickle cell anemia, and other things like that. And so using a broader set of data, we can target those type of public health initiatives to the demographic if we have enough data to make those correlations. And I really think we'll see that going forward. The other important thing as I look at public health is the regulatory environment must support the movement from reactive to proactive. Part of what got the interoperability standard introduced and beginning to be accepted throughout the United States is that the largest insurance carrier, the federal government, through Medicaid, Medicare, and CMS, has mandated that standard. And so if they're going to pay you for care of patients, you must have that interoperable resources. The ones that do not do that, they are not eligible for Medicaid, Medicare reimbursements. And sometimes a big stick works as well as saying this is the logical thing to do. The interoperability will make it more effective for your patients, give them better care. But that's a slow change. The big stick of saying we're not going to pay you has accelerated that as well. And as I look at public health, there's places where that type of acceleration really is helpful as we move to this new types of medicine. You know, if I go back 25 years ago, genetic testing wasn't there. Manipulating genes wasn't there. Personalized medicine was a dream, where today personalized medicine has become a reality. The ability to take what was once the domain of just a medical doctor and now spread that out to where you have physician assistants doing 90% of what a medical doctor can do is game changing as you look at access to healthcare. The fact that you begin to see doctors who do not have physical clearance, but they specialize in telemedicine and doing remote medicine was unthinkable. Really, you couldn't even imagine that 3 years ago because of the rules around telemed. So we have made tremendous advances in healthcare. The digitalization has helped. I love some of the new artificial intelligence image recognition. There was a study I actually was reviewing this morning that says that AI image recognition does a better job 90% of the time than a human in reviewing x-rays and CAT scans and MRIs. But it's not as good for complex disease. So that fusion between us using the digital resources and the human resources and applying it where it fits the best is one that the healthcare system and public health is really struggling to come to grasp with. Is when can we use machines? When does it have to be humans? And when do we have to do it in person? And when can we do it remotely? And can I use my consumer grade medical devices like on my watch or devices that I plug into my smartphone versus having to go into a clinic and use pure medical grade devices, which in many instances give the exact same data. Those are all some of the grand challenges that have to be resolved in healthcare, particularly as healthcare goes more global. And if I were to stage it, that's kind of where I would stage it now, is that we have the basic capabilities and protocols and standards to have electronic records talk to each other. We have the protocols and standards to let medical devices, for the most part, interop with each other at a data level. So how do we solve the other elements? How do we solve the people culture level? How do we solve the regulatory compliance levels? How do we solve the reimbursement levels of healthcare? Even in nations where the healthcare is paid 100% by the government, you still see people having to go outside that system because of inefficiencies and the access to care when needed, particularly rapid access to care for critical illness. These are all, like I said, some of the grand challenges. And those are the ones that we have to come and address to make healthcare more universal, to make healthcare really become the ability to take the advances we have and the advances that are to come and be able to apply to a broad population and to broad demographics. We're getting better every year. Still have a ways to go, but I think we'll see in my lifetime regenerative medicine changing healthcare. I think we'll see in situ sensors in our body changing healthcare. We'll see drug delivery by bots within our body changing healthcare. And we'll see the ability to have real-time interaction with doctors that will change the dynamics of how we perceive healthcare. And will make it where we hopefully will go a long time absent exercises, accidents, with a healthier life going forward. But to me, that's part of my dream getting there. And it's the grand challenges that really have to be solved. And many of those happen to be people-based. And we really need to work on that full ecosystem to be successful in healthcare. Sharif, thank you again for this opportunity.
Thank you. Thank you. Thank you. Thank you, Professor David. Any of the speakers want to add some point or has any questions to Professor David? Okay. I want to ask you one question because when we develop our policies and other things, most of the cases I observe in developing nations, they get different collaborations and support from different developed nations. But what we are observing in COVID-19 situations that actually many of the countries struggling with their healthcare system. So what is your advice for these developing nations for healthcare policy developments after this COVID and pandemic? What area they can focus or improve for policy development?
It's an excellent question. I'm a fellow at a university in Brazil. And Brazil is being extremely hard hit right now. And I've had some discussions with some of the ministers and others down there. And what I see happening, and Brazil is on the higher end of the developing nations really, is they are trying to take models that work in the United States. They're trying to take models that work in Israel. They're trying to take models that work in places where they've done well and apply them without modification within their unique environment. And my advice to regulators is you can look at the best practices from others places, but those best practices have to be modified to work within your region, within your area. Because again, just like my example that medicines and test results are different from Maine to Louisiana to California, it's the same thing. The difference of a test from here in Texas to in Sao Paulo, Brazil, are going out more in the country to Curitiba or places like that. They're very different. And even in Brazil, it's different from Sao Paulo to Rio to Curitiba to other places like that in Brazil. So you have to understand the best practice, but understand it has to fit with your country, with your demographics, with the resources you have available. And even in the early stages of COVID with people who got put on respirators, we saw different types of respirators being developed because of a shortage. And the different types had different efficacy coming out of it, different effects on the different sides. Again, it's you have to think locally with the resources you have available. In developing nations, I think you're going to rely more on digital healthcare, more on telemed, less on clinics as you go forward. And that needs to be factored into any policy, I think, that is put in place in developing nation. And the key to having digital healthcare work is the interoperability and the data flow of all that data, because that's how decisions are made, that's how treatment is delivered, and the elements there. I was involved with one of the first remote surgeries from Johns Hopkins in Maryland to Singapore. The amount of bandwidth it took to do that was unbelievable. The cost factor was not sustainable. But today I can do that without the large costs and things like that. So even surgeries are things that can now be done digitally, even though you're physically with the patient using robotics. Those are things, if I was in developing nation, I would look at too, because it takes the advanced resources you have and it multiplies them where they can do things without the overhead of travel and others. And the same for the patients. So that would be my recommendation in a developing country.
Thank you, professors. And World Talent Economy Forums, we are actually people-oriented organization. Yes, we are advocating for modern science, modern engineering, modern technologies, and we are always try to connect with the developed nations, with the great scholar like Professor Donalds, even Madam Durgadas, Professor David Smith, Ali Rice, James Eid, many of the more than 300 people from around the world, they are joining in World Talent Economy Forums. And our objective is that we have to improve our life and we need proper collaborations, proper partnerships. And most important thing is that when we discuss about human developments, for human resource development, we need to create good example. We have lot of heroes. Some of them are sportsmen, some of them for media, some of them for here. They are too much of corporation. They are utilizing their most of their money for sales and marketing team, this, that, branding. But World Talent Economy Forum, we believe in knowledge, we believe in modern science, we believe in modern technology, and we believe in uh, good example. When our youth community from Asia Pacific, they believe that, okay, I want to be like Professor David Smith, that will be the real change, or like Professor Donalds, or like Madam Durgadas, or Ali, or James It. This is our objective. We want to create a good example. But most of the cases, we tried our level best, and we are also developing many projects. I want to invite you all, especially for academia, for energy, different kind of things we already developed. Then we come to the social media. It's not that we do in social media, then we are trying to connect. I can invite you, many of my friends from Oxford University, from Cambridge, from Harvard, they're doing internships in my and our organization in Bangladesh. Regularly we invite them for internship and others, and we want to invite you that what type of projects we are doing. We are discussing about future of university, and we are developing about green technologies, and we are implementing it. We are helping different governments and different countries to apply it. But we need more support, we need more team ups. We want to open for collaborations and partnership. But why I discussing these things again and again? First few times, even yesterday, how I uh, find our presentation, it was excellent. But after that, few of the people from the social media, they are trying to manipulate our branding without know much about me, about my global perspective or reputations, as well as our organizational reputations. And I believe that they are also trying to disrespect our speakers. uh, I know 99.99% people are good, few people are bad, few people are actually trying to create problems. We don't mind, we will improve, we will move forwards. And I want to give special thanks to our speakers, those who always support World Talent Economy Forum. But fact is that it's a year and years, million of people we engaged in the real life, Then we come to the social media, because personal life, from my personal life, I get a lot of support, collaborations, partnerships, guideline from developed nations. My major change happening when I first visited Oxford University. So I believe if this kind of like brilliant people, I can create example for the developing nations. They have money, they have resources and everything. What is their problem? They do not have real hero. They need more hero. That's why we put the name World Talent Economy Forums. But I request our audience, be respectful, even respect some of the people. Even you do not like me, this is also possible, but be respectful. Sometimes we are actually, we, not only me, my team, Humaira, Tanzila, Sohel, Rana, Aaron's, many people actually doing very hard work, so they feel very bad. So on behalf of my team, I request everyone, be respectful, at least respectful for our speakers and others. But some people, how they behave and how they promote, how they do work against World Talent Economy Forum, we have zero tolerance about these things. Even it's continue, all of the social securities or the cyber securities or the lawful initiatives, World Talent Economy Forums move, because we have accreditations, we have registrations, we have everything. Any kind of negative things, we will not tolerate. Sorry, I just add, because we are facing very negative things last few days. We do not want to come to the public, but we have all of the honest intention, but until or unless people are honest with us and respectful for us. But I really grateful to our speakers, really feel proud that when they support our World Talent Economy Forum. Trust me, you are actually helping millions of people with your guidelines, with your visions, with your scientific knowledge. Thank you, everyone. Now I request Madam Durgadar, sorry, I take some times, sorry about that, for your final speech. Madam Durgadar.
Yes. First of all, I have to say one thing to Sharif, right? Thank you always for having me. But remember, when you're never successful until 10 people start throwing stones at you. No one's throwing stones at people who are no worth, right? Have you ever seen that? Do you go see somebody who's of no use to you and then start screaming at him? No.
Mhm.
You only shout at people whom you see going up, doing well, and then you want to pick a battle because you're insecure or you have some fear or you feel that you are not being recognized. It's one's own incapacity to understand that other people can do well, and if I can't be part of it, I can at least applaud it from the sidelines. So congratulations to World Talent Economic Forum, because you've just validated that you are a fabulous platform. You validated that you're doing things with great intention. You validated not only all your speakers, but everything that you've done so far. So congratulations to you. And
Thank you.
please tell to those naysayers, thank you very much for, recognizing us, because obviously we've made a difference in your life. That's all,
Thank you.
that's what I would say. Don't even bother about it. Just say shush and keep moving on. It's not
Thank
worth
you.
it,
Thank you.
right?
We will. If we get all of your support, definitely we
No,
do
you
it.
don't need
And
anyone's support, Sharif. You have it, but you don't need it. I'm telling
okay.
you, trust me, from my own personal experience. You only make enemies when you become successful. Otherwise, you have
Okay.
zero enemies.
Thank you.
So if
Thank you.
you've got 10 enemies, applaud yourself. If you've got 20, you're certainly a rising star, my friend. So don't worry about it. Our support is there, but you got to think differently. Don't worry about
Yeah.
this, okay? So I'm going
Thank
to
you.
keep
Thank you.
my message really short because, everyone said everything that's of any value. I'm not sure I really can contribute too much, but I'm going to say a few words, and I know you're running out of time. So I'm going to pick a little bit of what everybody said and then have my little 2 cents in everything, right? Because I come from an Indian perspective. Of course, while I lived in California for 25 years and experienced what it was for better part of my life, what it would be to experience the Western world and the ease of life. I was born in India and I know life here. I've come back here to make a difference. So I would, like always, I'll speak from the Indian perspective to add value to those who come from what we call developing nations, even though I think India is like much better than most developed nations. But anyway, having said that, Like James said, he said his mother had a personal doctor. James, I have a personal doctor. Even today, your mother is 90 years old. I'm in my 50s and I have a personal doctor. That's India for you, right? In India, till 30 years ago, honestly, everyone went to a family doctor. That family doctor knew everything about you, your spouse, your children, your parents, your grandparents, and your dogs and other pets. The maid you had, the kind of food you eat, where you got angry, the stuff that upset you. He knew everything. And if you went to him saying, I'm feeling sick, he'll say, you should just fire your cook because that's your stress. Well, that that's your doctor for you. And that was still 30 years ago, right? And okay, things have changed a little bit since then, but we still have a doctor we go to. No matter what happens, we go to our doctor. I could be having a cardiac arrest, I go to my doctor, and then he will send me to a cardiac doctor. Right? So we still have in India, even in this, I'm talking about the main cities, a lot of connecting to our personal doctor, okay, who knows a lot about us personally. In the villages, it's a given. There is only one doctor who takes care of everybody. And he knows everything, including who slept with whom and why the problem is. So that's the way it works, and that's India for you. But we're 1.3 billion people over, several thousand villages. But that's how it works. But having said that, interestingly, India is one of the few countries that has adopted digital health at the rate, I think in the last, from 2014, at the rate of 76%. Believe it or not. Can you imagine? This country that has a personal doctor has gone from $116 billion digital health industry and slated to become $485 billion in the next 4 years. Unbelievable. But this obviously spreads into telehealth, mobile health, electronic health records, electronic medical records, and other remote diagnostics like, David spoke about, remote, surgeries, remote monitoring, remote health. But having said that, while we've adopted this technology, the government also went as far as creating in 2020, in August 2020, in the middle of COVID, the National Digital Health Mission, knowing that this is something we need to do for a country of this size, or population size, to be able to manage future pandemics. And of course, we know from now that this COVID-19 isn't going to end with it. It's going to be 2021 and then whatever other names we come up with. This is going to keep continuing. And so they have the common sense to say, well, we have to do this, at least to keep track of our citizens. They have mapped this into what we started a few years ago called the Aadhaar, which is very similar to our social security system in the US, right? I came to the US in, 92, I think. And the first thing I had to get, no matter what I did, where I lived or died, was get an SS number. And then everything in my life was based on that SS number. We never had this in India. There was nothing to connect my car to my home, to my bank account, to where I went, nothing, and my credit card, nothing connected to anything else. And then we got this Aadhaar, which was set up by Nandan Nilekani a few years ago. And now everyone was made to get one compulsorily, connected to their passports. In my case, whilst I have an American passport, I have an Indian, what they call a overseas citizen of India, an OCI. And so I connected it to that, right? So they know that I'm here, and that's how my bank records, my financial records work. And they're slowly connecting it to different parts of our life. And then this National Health Mission is supposed to then connect into that. So several companies have built into bringing technologies to, done things to digitize medical records. But still, there is quite the issue of whether people are going to use it or not. because like I'm not sure who mentioned, David, maybe, I think the access to this record for me personally is not easy digitally. It may be with my hospital, maybe with even my doctor, but it's not accessible to me. And that gives me a sense of worry. And then if I travel to a remote location in India, which is remote, in India, when I say remote, I'm talking about 200 kilometers outside the city, right? That's remote enough because the internet won't work. Or the telecom provider there won't work. I need to have another telecom provider for which I have to buy another SIM card. And it's just a whole lot of stuff that one has to go through that one doesn't want to go through. So therefore, I definitely don't have access to any records. If I fall sick, 200 kilometers outside my home in a city, I have no access to it. That gives me a sense of worry. So yeah, the country has jumped dramatically into adopting digital health. But who? The providers, not the adopters. They have to do a lot to get the adopters to the table in terms of sense of security, a sense of comfort, a sense of access, right? And the ability for me to know that, oh, I got my doctor on my phone. No matter where I go, I'm always taken care of. That's a long way away, according to me. But having said that again, look at Theranos in California. My God, the bullshit they spun. And every investor and then some with a brand name to his name went down the drain. But here in India, we have one little guy called ThyroCare, right? He spent less than $1,000, maybe less than $500 to begin ThyroCare. He worked with the Baba Atomic Research Center for 14 years. On the design, he came from a village with 500 rupees, which is less than $1 in his pocket. Oh, no, not $10 in his pocket. Started ThyroCare and just sold a deal for $1 billion valuation to Pharmacy. And what he provides is nothing but what Theranos promised, right? But in a simple way, he set up 40,000 centers, giving people access to getting their blood tested, their thyroid tested, their heart tested, their blood pressure, every test that you can possibly want done, right? You call and someone comes in like 5 minutes, gets it done, and then in the evening you have your report. Done. Simple as that. So this is also possible in India, right? So we do have the technology, we have the people who can implement this. And what failed, in California is happening here. Well, it's not as fancy as the little gizmo she was trying to sell, but yeah, more or less there, right? I want to get into the topic of what most of you talked about, the use of devices, right? Everyone has some device or the other. And here in India, we have 1 billion people wanting to use a device. And trust me, while we have 30% of our people living in cities who have the ability and we think the affordability to afford a device, the other 70% in the villages have more money. And they have the better devices. They just don't know how to use it. That's all. But they bought it because the city guy got it. So I got one too. Now the people in the city who have these devices, right? Apple came out with this, Samsung came out with the other, and someone else, oh my God, you won't believe it. They change these devices every time somebody comes out with one just to keep up with the Jonases next door. And no one knows how to truly use these devices. And that's not the worst part of it. Everyone is trying to use these devices, and now they start monitoring themselves. Oh, it says I walked 1,000 steps. Oh my God, tomorrow I got to do 2,000, 10,000, 50,000. Are you mad? You will die of a heart attack. They have no idea when to stop. Because now these devices are telling them that they're superheroes. And if you go, there's a thumbs up sign, there's a flag waving, there are stars going into the device or into your phone or whatever you got. And they're all over the place. Everybody's running all over the place here. When I was in California, living in Los Gatos, I used to look around and say, why is everybody running at 2 o'clock in the afternoon? Are they mad? Crazy. In that sun, in that heat, why would you want to run? Why don't you run in the morning or the evening? But I would see everybody running up and down those streets at 2 p.m. I would think, my God, these are a bunch of crazy people. Then everybody went vegan, and vegan like to an extreme. I'm thinking, like, I was born in a vegetarian family, but this is like, why does everything have to go to an extreme? I'll tell you why. Because these devices prompt you to go there. These devices tell you how it's better, and then something, and then you achieve this and you achieve that. And you achieve everything till your heart stops and you will die. Then you achieve the best. You've died. God bless you. Good for you. Just remember to take 6 feet before you do the last achievement, the last flag winning pole. Because this is ridiculous. People have no idea how to use these devices. Because the device manufacturers are very intent on selling you. Trust me. That's their job, and I don't blame them. That's their business. And then they have the content around these devices, where you go online, you download this, you go there, you download that, and then this will help you do that, and this will help you cook the next meal, and the meal will then tell you how much more to run and how much less to walk. Seriously? God, this is a full-time job. Wear the device, go online, connect to the apps it tells you to do, and then just follow it. This is your 24-hour full-time job. And if you do it, then you're a champion. Unless you're dead, of course, before that. So the problem I feel is people are overusing devices with no sense of whether it's going to truly help them or harm them, right? And then I want to get into the subject of yoga, of course, right? I come from the land of yoga, Shivananda, Rishikesh, right? I've been there. My mother played music for Shivananda. Right? She actually played the veena for Shivananda. Right here in Chennai, we have the best yoga institutes. And I truly respect yoga, and I truly respect yoga masters and teachers, because it is a true way to live a better life. Honestly. But the yoga industry is $66 billion industry now. Let's just think about that for a moment. I want to be a yoga teacher. What the hell am I doing building Aero Nero? It's ridiculous. Making what a waste of time. I want to go build yoga institute. I'll make my next billion right there. 66 billion? Seriously? Is anyone qualified to run it, teach it? And then the worst part, teach it online. I had a friend, and believe me, this is a true story. I was living in Los Gatos. She was living closer to Los Altos. Actually in Los Altos, right? What was her name? Charlotte. Right? Thin, beautiful Californian girl. And she was into yoga like nothing else. And I used to tell her, you need to have a teacher. You can't take yoga beyond a certain level, because if you don't have a teacher, it could harm you. It's like breathing. If you don't know how to breathe properly with a proper teacher, you could die. Well, anyway, she was into headstands, and she was always doing headstands wherever, any time of day, morning, noon, night. She was up totally into headstand because it was giving her the rush, just like, a little meth would do, or a little coke would do, or a little whiff of whatever you think your latest fantasy is. That rush was enough to spoil her brain. She drove her car off the Los Altos hills. And this is a true story. She's my friend. This is yoga, misguided yoga. And imagine teaching this online. And everyone acting like they're the next best yoga teacher. And we have all these students saying, okay, well, I want to do this because it's making me feel good. Yes, initially it will make you feel good. But if you don't have a proper teacher, and if you, I wouldn't say abuse it in the word as in abuse it, when I'm saying overuse it and overdo something, nothing in balance is good for you, right? Everything in balance is what it needs to be. And online doesn't teach you this, because I need you online a few minutes more in my yoga class. Why? Because I make money from ads. You know why? Because I give it to you for free. You know why? Because my competitor charges $10 and I don't want to charge you $8. So I'd rather do it for free, get you on me. But my investor told me the minute I have 100,000 users, he's going to give me $1 million more. And therefore, I need all of you online that much more to see the ad. And therefore, you will overdo yoga. I mean, it's just a marketing gimmick. 66 billion in the next few years. It's not a joke. So anything, devices, yoga, not used right, in any part of the world, developed, underdeveloped, is irrelevant. It's just bad use. That's all. Right? And then I think David mentioned Sao Paulo. I was there. They're poorer than India. It's shameful. In India we have beggars, but they're living quite all right, and we have sun. We don't have snow and freezing rain, thank God. So they're quite all right with the sun. Sao Paulo, and they were really, really poor people. I felt sorry for them coming from India. With our beg, I thought our beggars were rich compared to them, but they're all misguided. They all live in shitty homes, and then evening they'd get dressed up and they go out to clubs to find somebody. That's where they spend their money, not to fix their home. And when you look at Sao Paulo trying to copy America or the Western world in fixing a health problem, it's wrong. We should look at India because we're similar. We're all equal poor people. You live as pathetically as we do. So if we are fixing a problem a certain way, you need to check with us because that's probably going to work for you too, right? It's not what's working in America. That's not going to help you at all. And last but not least, then I would like to wrap up with this. Mental strength and a sense of feeling good can cure most anything, more than any device that tells you how much you did well, how not, how many doctors you have, personal, medical, digital, email, everything put together. At the bottom of it all, it's all about self-worth. You feel good, you'll be good. You'll be good. Louise Hay said it all. I don't know how many several times and all. Our health is a manifestation of how we are in our body, in our minds. Just on a personal note, right? I had a brain tumor. I didn't do surgery as they asked me to do because I had to supplement with hormones, and I said I wouldn't do it. They said I would go blind. I said, well, I'll come to you when I go blind. I didn't take medication. I'm not prescribing this to anybody, please. Since we're online socially, I'm not prescribing this to anyone. I'm just saying, I just decided to focus on life positively. And believe it or not, 8 years later, I didn't have a tumor.
Wow.
And if that's weird enough, here's my mom who had pulmonary thrombosis 4 years ago. Not one clot, but two. She had COVID last month. She's 79 years old. She fell down, she broke her shoulder. She can't walk, she needs knee replacement. And then she got COVID, and she was over 50% in her infection rate. I told her, you're negative, Mom. We're all negative. Let's all have medicine to avoid it. And she said, oh, good, good, good. Let's all take medicine to avoid it. So we all took medicine to avoid it for 4 weeks. Trust me, she came out of it. And then I told her, Mom, you had COVID. She said, really? You didn't tell me? I said, well, what was the point? You just worry about it and get sick and get palpitations and have anxiety and die. So if you're going to die, you'll die anyway. I'd rather you die happily, right? Thinking you didn't have it. And that was it. I didn't take her into hospital. I take care of her at home, nurse her through the night. Right? My point is not to tell people don't take your parents to the hospital if they're unwell. It's not that. It's to say that I tried to give my mother a positive message because the other complication she had didn't make sense to go to the hospital. It was more practical. But by just giving a positive sense of hope that she was fine, believe it or not, 3 weeks later, she was up and about. She was running around talking about what she's going to do to help some other village. So the mental strength that is so important in this digital world, I think is very, very critical. And that's what I'd like to say. Thank you.
Thank you. This is really, really great and inspirational, like things you share with our audience. And definitely, I know even my mom, she's also very sick. Pray for her. So this is very important. We need a mental treatment. We need to careful about that. And definitely, I request all of our audience. We have many important speakers. I think they can help you a lot with your personal life, with your career developments, with your business development, organization design and development, everywhere. So if you want to communicate, I am sure they are very active in social media. You directly can communicate with us. Beside that, World Talent Economy Forum, this is our second day of our conference. So we have our 3 more days for this healthcare related conference. So tomorrow we will discuss on healthcare system as well as climate change. So those who want to join in our conference with your story, with your presentations, with your research paper, you directly can communicate with us. Beside that, World Talent Economy Forum, we are developing different courses. We are engaged with industrial research as well as different kind of consulting we are doing. We are open for collaboration. So those who want to collaborate with World Talent Economy Forum, uh, we will collaborate with them. And I request all of our speakers need more of your support, more of your guidelines, more of your collaborations for the talent economy, because now we have to improve the talent economy. We have to connect with all of the talent economy and talented people around the world. And most important factor is that for them, you people are inspirations, you people are model, you people are example. Let's say how Madam Durga Das share her experience. This is the explanations, analysis from her personal life. This is very valuable for us. So thank you everyone for joining today's sessions. Hopefully we can arrange more discussion and more activities. Thank you, Professor Donalds, Professor David Smith, Madam Ali Rice, Madam Durga Dash, James Eid, for your continuous support for World Talent Economy Forum. And thank you our audience. And I really want to give thanks to our team, Humaira Tanzila, Sohel Rana, Ferdosara, even Aaron, everybody actually from back end, they are also supporting World Talent Economy Forum. So thank you for joining today's session. Bye bye and take care.
Thank you. Take care.
Thanks. Bye, guys.
Bye.
See you
Bye.
soon.
See you soon.
Bye.
Bye.